Good evening and thanks for joining us on our COVID-19 update. I'm Ladi Akeredoluale. Here are the highlights at this hour. Some Nigerian students protest the continued closure of tertiary education due to the COVID-19 pandemic. Nigerian Football Federation directs tests for all staff after a positive case is identified. And possibly the last Nigerian evacuation flight out of South Africa takes off tomorrow. Students of tertiary institutions across the country are protesting the continued closure of their campuses following the outbreak of COVID-19. Addressing journalists at the Unity Fountain in Abuja, the president of the National Association of University Students, Comrade Felix Ijegalu, says if the government can reopen religious places, markets and airports, their campuses should be reopened for them. However, the protesting students were restricted to the Unity Fountain, and that did not go down well with them, and they insisted that they would not be intimidated.
We want the ministry to give us a propelling ground for our schools to reopen. Every sector in this country that people gather have been opened. Airports are planning to open. International flights. Marketplaces have opened because they pay tax. Transportation is working because they pay tax. All the financial institutions are working because they pay tax. But they have forgotten that the most important sector in this country is education. Yes. Because anybody who is telling the agencies, the law enforcement agencies, to drop us down and clamp on our voices should know that he was once a student. Most of them feel because their children are studying abroad, so they don't care about what happens in our country. People are proud, public servants are proud that our schools are locked down and they are going for convocations outside Nigeria. They are going for matriculations outside Nigeria. We are being intimidated that we cannot speak our voices, and then we are being told that if we step one foot, we will be shot. Then they continue to shoot us. Every university student life matter. I don't know why this country is neglecting educational sector. We have sent letters severally for the ministry to brief us on the situation on ground. And all those letters were ignored. And now there's a protest and some people are going to have a roundtable discussion.
President of the Nigerian Association of University Students, Felix Ijegalu. In Gombe State, a senior secondary school student who tested positive for COVID-19 has been writing his examinations from the isolation center. He wrote his third paper today. And now it appears more students will be joining him, as the latest reports indicate that 7 more senior secondary students have tested positive for COVID-19. And following the directive by the state governor to have all students under the exchange program tested for the virus, this is looking more likely.
This is the Gombe State COVID-19 Isolation Center, a public health facility at the Gombe State Specialist Hospital. A medical officer and the State Commissioner for Education are getting ready with their PPEs for a special assignment.
I'm Honorable Commissioner for Education, Dr. Sanya Liu. I've come to see that in the interim, I hope they are giving you your food, they are giving you your books, you are reading here.
The assignment is to oversee a senior secondary school student who tested positive for COVID-19, but has to write the examination at the isolation center where he's being managed.
For us to go in, because we are normal persons, we are not infected, so we must protect ourselves. So that's why we have to put on the personal protective equipment. This includes the headgear, the face shield, the face mask, then the PPE, and then the boots. Then when we go in there, we have to also observe social distancing. We don't go too close to him. We allow him, and we don't scare him. We just have to be very friendly, and we talk to him normally. Then we boost his morale, and we ask him to start his exam. Then the invigilator, who is the custodian, will brought out the question paper and presented to him. He now read the instructions, and we get the invigilator is still there now. He looked at the time and said, "You can now start."
7 more students have now tested for COVID-19 in Gombe State, and they will also be moved to this facility to write their examinations under close monitoring.
Students of various government-owned higher institutions in Kwara State are staging a demonstration calling on the federal government to urgently reopen their campuses for learning. The representatives of the various higher institutions in the state say if markets, airports, and worship centers could be allowed to open, why deny the students their rights to learn? Their long stay at home, according to them, is already having negative effects, with some said to be engaging in vices across the country. Meanwhile, as exit students continue to write their WAEC examinations, teachers and students have also continued to adhere to the COVID-19 safety guidelines. Channels Television visited some of the schools writing the examinations, and will bring you updates from Taraba, Ogun, and Delta States.
Exit students in senior secondary schools are in the 3rd day of their final year exams, as teachers and students continue to adhere to the COVID-19 safety protocols to stop the spread of the coronavirus. In Abeokuta, the Ogun State capital, the principal of Baptist Girls Secondary School, Idiaba, passes a vote of confidence on the examination body for a seamless process, which began on Monday.
We've been able to subdue the pandemic itself by having everything in place, like the hand washing space, and we have trained our teachers and students to use their mask at all times. And if you went through the classrooms, you will see that the children were well distanced. So we don't have problems with that, handling the pandemic.
The compliance level to COVID-19 protocols has been encouraging in Delta State, with the use of face masks, hand wash equipment, and the observance of social distancing, which the state government promises will be sustained.
Since the YS started, the students have been complying. Even the invigilators too, they have been complying. It has been running smoothly, no problem. The children are comported.
And in Jalingo, the Taraba state capital, it's not an entirely rosy situation, as some of the school authorities have to deal with porous territories and dilapidated structures seen as a risk to the health of students.
We are facing a lot of challenges because we don't even have security. We normally employ security so as to help us to man these places. If you can go around, they decided to break the perimeter fences so that they can have it as their way in. I called Mercy, we buy blocks and cement, we put it in order, they still went again and do it.
Nevertheless, it's a relief for the students who finally get to sit for these important papers, and despite their environment, they seem happy with the measures taken so far to keep them safe.
The arrangement also has encouraged students to depend on themselves, not to depend on any other person.
The end of the WAEC examinations is still about a month away, and the expectations are that all concerned in the conduct of these examinations will ensure safety first at every point during the examinations.
In Adamawa State, the government there has threatened to seal up any private secondary school that fails to meet up with the COVID-19 regulations put in place for the conduct of the existing students. The State Commissioner for Education gave the warning while on a tour of private secondary schools to monitor their compliance levels in line with the COVID-19 directives of the federal government. According to the Commissioner, government cannot afford to toy with the lives of the children because they are the country's future and should therefore be protected from the dreaded disease by preventing community transmission.
The task force team led by the Commissioner for Education in Adamawa State is out today to monitor the compliance level by schools during the West African Examination Council exams in the state. Today, her team is visiting private schools in Yola, the Adamawa State capital. Unlike public schools where the examination halls are overcrowded, the private schools seem to be doing better. Some of the schools visited are Aliyu Mustafa College and Concordia College, both in Yola.
The exams has been good. So far, so good. The children are well spaced out according to the directives of government, and not only LCDC, but the state government too is going on to be sure that we are in compliance with all the rules. This morning we have chemistry exam. Instead of using one lab for 36 students, we are using 2 different laboratories in order to comply with spacing. That's what we have done so far.
The State Commissioner for Education expresses satisfaction at the level of compliance, but then uses the opportunity to serve a note of warning to owners of private secondary schools in the state.
I'm not joking. We are talking of life here, life of our children, life of that's the future of Adamawa State. And I want to make sure that these students and the parents at home have confidence in what we are doing out here. That's why I'm out here to monitor and to make sure that there's compliance, total compliance with COVID-19 guidelines. If they did not comply, I promise them I'm going to seal up that school, especially if you are just staying in a garage, claiming that it's a school and not complying.
The Adamawa State government says it is doing all it can to ensure that the conduct of the WAEC examinations is done in an environment that will curb community spread and will also be in line with the federal government's directives on the COVID-19 pandemic.
One of the new ways of observing COVID-19 prevention is the use of disinfection tunnels. But there's been a bit of concern about its usefulness or otherwise. To help shed more light on this and other adjoining issues, I'm being joined on the program via Skype from Port Harcourt, the River State capital, by public health physician, Dr. Esther Azi. Good evening, Dr. Azi. Thank you for your time this evening. Dr. Azi, can you hear me?
Yes, I can hear you. Good evening. Thank you for having me.
Good evening. Thank you for your time. This controversy would not have arisen except for the fact that during the course of the week just gone by, we had the national coordinator of the Presidential Task Force, Dr. Sanya Liu, saying that the science doesn't support the use of disinfection tunnels. Many of those who are using disinfection tunnels, of course, are using them for mass areas where they expect a high level of traffic, like airports, schools, and so on. What's your take on this?
Okay, so for us to understand the need for disinfection in the public place, we need to know how COVID-19 is transmitted. Okay, so we know that it is transmitted directly through release of infected droplets from an infected person, or indirectly when someone picks fomites from surfaces. And we mean high-touch surfaces in the areas like you've mentioned, malls, parks, and transit, public transportation systems, anywhere that has a high traffic of people, and of course the high-touch areas. So while we know that disinfection helps in eliminating the virus, in decontaminating surfaces that have the virus, disinfection tunnels really, there's no evidence for now to show that they are effective. One, because you don't know how many hours people will pass through, the contact of hypochlorite solution or the mist that is being sprayed on people. It's really the hands that matter. So wherever their hands touch, because it's people that carry along the virus, wherever their hands touch, those are the places that should be concentrated on. And we cannot be so sure that going through a tunnel, and being sprayed by a hypochlorite mist from head to toe will do that. So what is usually advocated is that high-touch surfaces should be decontaminated with a wipe and maybe spray bottles. That would need a lot of manpower, no doubt, but at least you're sure that you're getting to the areas that really need to be covered. So for now, there is no evidence to show that that is doing the work. A lot of high-tech gadgets, form of drones, fire engine trucks and tankers spraying public areas not just disinfection tunnels, just to decontaminate the areas. But how effective these measures are, for now, we do not have evidence to show that.
That was going to be actually my next question, taking it from the issue of the disinfection tunnels. I mean, if the disinfection tunnels do not have very high levels, proven levels of efficacy, then how about those trucks that you mentioned that we saw in many public areas, in many capitals of states across the country, spraying, including Lagos, Port Harcourt, Enugu, a number of other places like that, spraying this disinfectant across wide areas, and we're said to be effective. Does it mean that science doesn't support those statements of effectiveness?
Okay, so do disinfectants work in eliminating the virus? Yes, it does. There is evidence to that effect. And the evidence exists among hospital settings, okay, laboratories, wards, clinics where swabs are taken and they're analyzed to be sure that after a surface has been decontaminated, then it's really, really clear of the microorganism, in this case, COVID-19. But for public places, we cannot say for sure. And let me explain that to you. First of all, the virus on its own cannot survive for long, on surfaces outdoors, at most a couple of days, and by nature of the virus, it is denatured by heat, sunlight, or temperature. And the same thing happens with the disinfectant solution that is being sprayed, where hypochlorite solution itself, can be denatured by sunlight. So imagine if it was sprayed after a couple of minutes, going to an hour, it might not be as effective. Okay, so is it also cost effective? We are not sure, because you spray a lot of high volume of solutions, and then how long will that protection last for? So that is why we say there is really no evidence to say that that in its own, not that it's bad, it's nice to have, it's a luxury, but on its own is a supplement in terms of environmental decontamination. And of course, it has its own issues, health hazards, and of course, hazards to the environment. We've had a lot of people who complained about irritation to the eyes and to the skin, even though it's a very mild solution, but it's a chemical all the same. People with respiratory issues have had to have issues because it was triggered, asthmatic attacks were triggered, or people with chronic respiratory problems also had issues after going through those disinfection tunnels. So ultimately, people shouldn't discard the real preventive measures, which are hand washing, frequent hand washing, social distancing, and wearing a face mask consistently and correctly. That in itself can just be a supplement.
We'll take a break. When we come back, I'm going to expand this discussion with you to look at the issue of international flights and this whole idea about mass disinfection and what happens when a lot of people are in enclosed spaces. Because coming from where you are, of what you've said so far, is pretty scary. Please stay with us. We'll be back after this break. Thanks for staying tuned. Welcome back to our COVID-19 update. Before the break, I was talking to Dr. Esther Azzi from Port Harcourt in Rivers State via Skype. Dr. Azzi, I did say that when we come back from break, I'm going to ask you, going from what you've said about the issue of disinfection and so on, let me bring it to what is about to happen. The aviation industry is about to open to international flights, hopefully from the 29th, which is just over a week away. And the part of the preparations that are said to be made is disinfection of spaces there inside the aircraft and so on and so forth. Does it mean is that also falling along the lines of what we're saying? That is that may not be the most effective method to ensure that people are safe within the aircraft?
Oh, no, not really. Like I said before, in preventing the transmission of COVID-19, we can do so by preventing the direct route, which is being far from somebody who is infected, even though they might be asymptomatic. And then, of course, indirectly by decontaminating surfaces and high-touch surfaces. So usually as a protocol before passengers board flights, surfaces are decontaminated, first of all. Now, once you have a high traffic of transit of people going in and out, it will be best to clean those surfaces not just spray people now, but hand railings, surfaces, high-touch surfaces like doorknobs, in between traffic of people. That in itself would be more effective as against just spraying the hypochlorite mist all over in the environment. You are not sure how long that will last for. So as a matter of protocol, there has to be environmental decontamination, but it has to be done right. That's it.
All right, then. Thank you so very much, Dr. Esther Azi, for your perspective and your time on the program today. It's been a pleasure having you.
Thank you for having me.
At the onset of the COVID-19 pandemic, the WHO's message to countries was quite simple: test, test, test. Well, it's been 5 months since that message, and countries have had to improve their capacity to try to stay ahead of the virus. Here in Nigeria, the country has tested over 363,000 samples for COVID-19 so far. Not where we ought to be, but it's far from where we were at the very beginning. An analysis of the numbers show that 1 of 10 has tested positive for COVID-19, as Nigeria's total confirmed cases now stand at 49,895, with the addition of 410 new cases reported in the last 24 hours. 74% of Nigeria's total confirmed cases, that is 37,000 plus, have been discharged. 24%, that is 11,870, remain active, while 2%, 981 people, have lost their lives to the virus. Here's a breakdown of the latest cases across 15 states and the FCT. Lagos has 210, the FCT itself has 45, Ondo has 30, Plateau 21, Edo 19, Oyo 13, Nasarawa 12, Bauchi 11, Enugu 10, Kwara 7, Kaduna 6, Anambra 4, Ebonyi 3, Abia 2, and Rivers 1. Plateau State says it has a backlog of over 3,000 pending results of samples sent for confirmation at the National Veterinary Research Institute in Jos, as the state records 1,857 positive cases of the COVID-19 pandemic. Permanent Secretary in the Ministry of Health in the state, Dr. Azuwat Polycarp, says that the non-functional laboratory at the NVRI has prompted the government to send samples to Abuja while the results are being awaited. He also observed that the increased number of positive cases are as a result of increase in the number of tested people, as well as non-compliance to the protocol guidelines.
We have one challenge. Our testing center, they are not testing for now because of some problems that they're having. So we are taking our samples to Abuja for testing. So the testing center in Vom is currently now working on the samples that they had for the problem that they embarked on. But the new samples that we're taking them to Abuja for testing. We get results from Abuja. And then some of the pending samples that were not yet worked on because of the problems in the testing center in Vom. When they release their own results, we combine them together with our one. That's how you get very high numbers. The pending results that we're expecting is over 3,000.
The Nigerian Football Federation, the NFF, has announced that it will undergo COVID-19 tests at its secretariat in Abuja on Thursday, that's tomorrow, after one of its staff tested positive for the virus. NFF General Secretary Mohammed Sanusi disclosed this, that after the test, the offices will be closed for the disinfection process while its staff will work from home. Alhaji Sanusi added that those who tested negative will resume work in the secretariat, while anyone who tested positive will be required to self-isolate for the period stipulated in the COVID-19 protocols by the federal government. Let's discuss with Dr. Akiala Ishaku, a virologist and public health expert who is in our Abuja studios. Good evening, Dr. Ishaku. Thank you for joining us.
Good evening, Ladi. Thank you, viewers, for tuning in.
Does it come to you as a surprise that the science doesn't support this mass disinfection process that we have seen with the use of disinfecting tunnels, that we have seen with people mass decontaminating areas in public, that we have seen right across the country, even as we were reopening?
Yeah, Ladi, that is a valid question. And I want to appreciate Dr. Esther Azzi for establishing a very true fundamental background to this. But that brings to the national question. Do we have a national guideline for air quality? Does NCDC collaborate with the Federal Ministry of Environment to come up with a guideline for the what we refer to as the evaluation of the air quality? Now, let me preface my submission by saying that we have a nation that does not value knowledge. If 5 to 6 months into the pandemic, we did not collaborate with other agencies in the Ministry of Environment to establish the air quality, then I think there is a gap. And I have been on this station several times to make prescription that there is need for us to have research, quality research, and also generate our data. Ladi, what stops us from engaging NESRA, which is saddled with the responsibility for air quality, to actually do an air quality analysis for isolation center, and then begin to see whether we can be able to isolate or harvest viruses in the air? What stops us from actually engaging NESRA to do some analysis of water and analysis even of soil to see that whether these viruses can be in the soil or be in water? Ladi, these viruses can be transmitted from human to human. In fact, let me shock you by most of the evidence, statistical evidence coming up now, that the virus can be transmitted from even animal to humans. So there is what it refers to as reverse transcription. So as you rightly said, it is quite a valid question. I want us to look at this as a nation, come up with a national protocol for air quality, because it is an interministerial response to this fight. And I felt like the Federal Ministry of Environment is left out of this. So we need agencies like NESRA to do air quality assessment, to look at the physical, to look at the gaseous component of it, and even the microbial component of it. You made mention of opening airlines. So have we done air quality for our airlines? So as we are resuming international flights, we need to engage environmental virologists to begin to see how they can be able to sample air within aircraft and begin to do analysis for this. This is quite key. For us to move forward, we must be able to bring into bear the knowledge of what is the dynamics of the transmission of this virus to bear.
The other thing, of course, is that now there are demonstrations have started in various parts of the country by students of tertiary institutions who are asking the question, if places of worship, if banks, if the airports themselves are now reopening, why are we still keeping the universities and colleges of education and so on still closed? Do you think they have a point, or is there really a public health issue with regards to these institutions and why they should remain closed?
Ladi, I want to say that I support the reopening of the universities, polytechnics and colleges of education, but they must be able to meet up with the guidelines. So I think the NUC and the National College of Education Council and the MBT are in collaboration with the Presidential Task Force, Federal Ministry of Health, to see how universities and tertiary institutions will be open. Now, Ladi, what is quite key is that can our universities and polytechnics and colleges of education be able to maintain social distancing in terms of lecture arena? Over 60% of our public universities in Nigeria don't even have a befitting dormitories. You can see that a lot of universities don't even have dormitories. Even if they have dormitories, these dormitories are overcrowded. So what we would have done in the last 5 months is to begin to have a strategic plan of reopening of our tertiary institutions. How far has our tertiary institutions even engaged these students while they are at home? Ladi, I lecture in the university. I'm pretty sure I've engaged a lot of my students. They have never had any call, any text messages, even from the university, telling them about COVID-19. So I think there is a gap even in terms of risk communication when it comes. And we need to also train our university and tertiary institution managements when it comes to about risk communication. This is quite key. And so I felt like they have a point. Universities, tertiary institutions need to be reopened, but we need to also meet up with the standard guidelines for the reopening of universities.
The other thing I want to take up with you, of course, still in the education subsector, is this issue of students who test positive taking their exit examinations from isolation centers where they are under the supervision of external people who do not have COVID-19, but now for the student not to lose the opportunity, they are allowed to do this. They're making provisions for this to happen. And more students are turning out to have COVID-19 in the course of these exams. Is this in any way a public health scare or safety issue?
Actually, so you can see that we have a gap. We have a serious gap. When we are calling for the reopening of schools for students to write in their exit classes to write their exit exams, we do not even have a subcomponent in our national guideline for this. So this just came up. And I think that the NCDC and Presidential Task Force need to reevaluate this and then come up with a guideline. So we need a lot of things for these students. Ladi, what is the psychosocial component of these students? Are we giving them the psychosocial, psychological support for them to be really psychologically stable to write these exams? What happens to the papers that they are even writing? Are they going to be disinfected? Because in the concept of disease transmission, there is what is called fomites. Fomites are inanimate objects that can be able to transmit disease. What happens to their papers that they are writing the exams? Are we going to disinfect these papers for the markers to actually use these papers, or even for people that are going to handle these papers to be? So it raises a lot of public health concerns. So we need to sit down and redefine most of these guidelines as a nation. So I felt like it is quite key. We need to actually attend to this psychology component of it, the psychosocial component of it. We also need to look at also the disease transmission dynamics component of it, and then from there we can be able to move forward.
I want to thank you so very much, Dr. Ekele Ishaku, for your time on the program. Thank you for those perspectives on the various issues. It's been a pleasure having you.
Thank you so much, Ladi. My pleasure.
About 200 Nigerians stranded in South Africa are set to be evacuated from the country tomorrow, the 20th of August. This will be the second of such special flights since the 25th of June, when the first batch of Nigerians were evacuated from the Republic. The Air Peace flight is expected to depart from the OR Tambo International Airport in Johannesburg at 2:30 p.m. To Abuja via Lagos. The evacuees include research students who have completed their work, those who work in Nigeria but have been locked down in South Africa, as well as those with pressing needs to return home. However, there are some students who have indicated they are willing to return to Nigeria but cannot afford the $840 airfare. Our South Africa Bureau Chief, Betty DBS, spoke to Nigeria's Consul General in Johannesburg, Mr. Godwin Adama, ahead of tomorrow's evacuation.
We have a last evacuation flight from South Africa to Nigeria on tomorrow, the 20th. And that is to give opportunity to all Nigerians that are stranded and could not make it in the last evacuation flight that took place on the 25th of June. Prospective evacuees have already paid directly to Air Peace. And then we are waiting for the final passenger list from Air Peace. But based on our records, we are set to evacuate about 200 passengers or more. I say that because at this moment, some may still be paying.
I understand a number of students are asking for the tickets to either be subsidized or to have a free pass on the flight. What's the situation with these students who are Nigerians?
Yeah, the students have approached us to subsidize the ticket by half, because that is, according to them, that's what they were used to paying. but we have tried to, on our own, take it up with the airline. Of course, it is not possible to do that for them. We all know the signs of the times. It is not easy for anybody, the private companies, no government, it's not easy for the governments. So we did not get anything possible for that to be done. And we communicated that effectively to the students through their leaders, that the best they could, the other option they have is to await the opening of international borders, which I believe will not be long for now. And for those of them that will be able to afford going now, they could take advantage of it, and I'm sure some of them have taken advantage of that.
Moving outside our continent to the United States, where as the number of people who have COVID-19 rose to 5.5 million, and as the death toll reached at least 172,048, there are more states that are testing fewer people. According to data provided by Johns Hopkins University, 14 states in the United States saw the number of daily tests per 1,000 people decline in the past week, compared with 11 that tested fewer people the week before. Meanwhile, the U.S. has had over 170,000 deaths, as we previously reported, and they don't appear to be set to decline anytime soon. Mariah Bird, our correspondent in Washington, has more.
The U.S. has seen a decline in coronavirus cases for more than 10 days, but death tolls across the country continue to remain high. Medical experts expect this high death rate to continue through September.
And the problem is that the first one, I have some hope about winning, but the second one is becoming more and more difficult to treat. And why do I say that? Because people are not listening. Whether it's, we're backed up by science or just plain old common sense, people are not listening. It's interesting because, I have been in the middle of earthquakes, in the middle of bombings, in the middle of tsunamis. I've been in every possible catastrophe that you can imagine. And by far, this is the worst. And this is the worst because this is a continuous situation. The other ones, something bad happens and then you run, you take care of things, and that's it. Here, continues to occur. And what is probably the most disappointing thing, the thing that annoys me the most, is that we keep on doing our best to save all these people, and then you get another batch of people that are doing exactly the opposite of what you are telling them not to do.
While the COVID-19 cases in the U.S. are declining, college campuses are becoming incubators for the virus. University of North Carolina abruptly changed from in-person to virtual classes after 120 students contracted the virus.
I think it is the best just to keep everyone safe. Maybe next year will be you can have your full experience without having to worry about getting you're staying your distance from other people. So I think it'll be better in the long run.
At all. I mean, even if we do have smaller classes, right, it would mean that everyone would still be in the dorms and there's communal bathrooms and everything. And if one person in the entire building, I feel like if they were to get coronavirus, then it would spread throughout the building.
As the U.S. still makes up close to 25% of the world's coronavirus cases and is only approximately 4% of the world's population, this proves that federal mandates and legislation may be the next step to curb the spread of the virus. From Washington, Mariah Bird, Channel Television News.
All right, let's talk to Mariah Bird now. She joins us from Washington, D.C. Good evening, Mariah. Welcome to the program. What exactly is the plan at this point? Because the numbers continue to go up, then they'll come down a bit, and then you have relaxation and they go back up. You talked about maybe legislation, the need for legislation and mandates. How would that work, especially since this is election season?
Well, at this time, it's really state by state. And some states are requiring, like in Washington, you're required to wear a mask the moment you leave your home. And so some states are taking on very strict regulations and mandates to be able to assist with curbing their state's population and contraction of the virus. But again, as you said, we are in election season. And so that is the main topic of discussion when you look at, we're right now in the midst of the Democratic National Convention. And that is one of the topics that I think many people are looking to see what will the next president do, whether or not it's a Democrat or Republican. How will they address being able to have more of a federal mandate to curb and hopefully eliminate the virus from the United States?
Now, Dr. Fauci, who was in your report there, said he didn't understand why people were simply not listening. He'd been in tsunamis, he'd been in all kinds of situations, but that in his view, this was worse. But that message does not seem to be seeping out. A lot of people in the US remain impervious to the COVID-19 protocols. They don't want to use face masks. They're not talking about social distancing. What is it that is being said on the streets?
Well, unfortunately, America is a very individualistic focused society. And so Americans have always stood for kind of having their own individual rights. And so that in this case is not proving to be beneficial to the American people. And so many times you are seeing that individuals, aren't believing in what's being said. And we've had, to be honest, very mixed opinions and mixed directions from our federal government and sometimes even the local legislators.
But going forward now, a lot of things are about to happen. A lot of things are hanging in the air now. First, there's, of course, the election, which is the big umbrella hanging over everything, and the possibility that the voters would have to vote under certain conditions. And then there are other things, people deciding whether to open or not open. And as you just pointed out, there's the issue of state by state, each state deciding what or what not to do. From what you're hearing, is there the possibility that there might be federal legislation that would override a lot of these mixed messages at the levels of the states?
Not at this time, and unfortunately, we don't have our election till January. And so depending on what happens come, our elections in November, but a new administration potentially in January, depending on what happens, that's when we probably will see. But I think over the next few weeks or months, we will probably not see any main legislation coming from the federal level to override what some of the states are doing and what's happening.
All right, then. Thank you so very much, Maria, for your time this evening. Our correspondent, Mariah Bird, joining us from Washington.
Thank you for having me.
Pope Francis has waded into the global vaccine race with a call for the world's poor to have access if one becomes available. Speaking to a general audience from St. Peter's Basilica, he says it would be sad if access to a COVID-19 vaccine was made a priority for the richest. He said it would be sad if that vaccine became the property of such and such nation and not universal for everyone. He insisted that it is imperative to find the cure for the small but terrible virus, which is bringing the whole world to its knees. Here's our global update.
Here in the port of Denia.
In other parts of the world, Spain has issued orders for an outdoor smoking ban, nightclubs to shut and a curfew on bars and restaurants to help slow the spread of COVID-19. Now, all restaurants and bars must close by 1 a.m., with no one being allowed to enter after midnight. In the U.S. state of Wisconsin, the coronavirus has not stopped Republican supporters from campaigning for the president. Some have been wearing face masks while doing so, but many do not, despite rising cases in the state, as well as the governor's orders to campaign indoors. Britain plans to bring in regular population-wide testing for COVID-19 to suppress the spread of the virus and limit restrictions that have crippled one of the worst-hit countries in the world. Health Secretary Matt Hancock says the government would expand a testing study from 28,000 people now to 150,000 people by October and ultimately 400,000 to help establish a better national picture of the pandemic and spot local outbreaks. The people in Hong Kong say a new round of relief measures introduced by the government will boost confidence and have positive impacts on epidemic prevention and control. Chief Executive Carrie Lam announced the decision at a press briefing ahead of an Executive Council meeting that the region would roll out the third round of relief measures to mitigate the impact of the continued COVID-19 epidemic on the economy. Finally, Colombia has resumed domestic flights after a break of 5 months as the South American country relaxes restrictions aimed at curbing the spread of the coronavirus. The International Jose Maria Cordova Airport reopened for flights. The president says it's an important step for reactivation of the economy.
And just before we go on, this day 6 years ago, Nigeria was battling a different yet deadly virus, the Ebola virus. It was in the thick of this battle on August the 19th, 2014, that Nigeria lost Dr. Stella Adadevo, who had raised the alarm while treating the index case, Mr. Patrick Sawyer, and ensured that he was not allowed out of the hospital's vicinity. Her heroic act curbed the spread of the deadly virus, helping Nigeria to successfully contain the viral hemorrhagic fever that has ravaged other African countries, leading to thousands of fatalities. A nurse, Obi Ejelono, and a hospital maid, Mrs. Uko, also lost their lives while caring for that index case. That's our COVID-19 update for tonight. You can take a closer look at some of the COVID-19 global numbers in real time by visiting our website, channelstv.com. There you will get more updates and a better understanding of all you need to do to stay safe during this period. There's also more on COVID-19 cases, figures, and numbers of recoveries in Nigeria, Africa, and the world. And of course, there are other stories on politics, business, and sports. Do join us for a fresh package of the program tomorrow, first at noon, and then at 6, and of course at 9. I'm Ladi Akiri Duluale. Do stay safe, and good night.